Lisa Waterman, and we're so glad that you're joining us to watch a couple of these few little clips, see if we can help you guys out with some quick questions during pregnancy. I went to OU for my undergrad. I went to Oklahoma State for medical school. Did my obstetrical training at St. Anthony's in Oklahoma City, and I've been here in practice for about 10 years. My interests are work, obviously, animals, animal shelters, cooking, running, biking, playing hard, living hard, live loud, live large. It's a little bit about myself. So today we are going to talk to you about nutrition, weight gain, exercise, kind of all those questions that people have right from the get-go at the beginning of pregnancy. How do we do it? What do we do? How long are we supposed to do it? Do we really have to? Just like we ask when we're not pregnant. So let's kind of start with nutrition and weight gain. We'll kind of combine both of those together. Most everybody is hearing in the news right now, body mass index, BMI. So when we talk about weight gain in pregnancy, we really want to base how much weight we want to gain on where we're at before we start getting pregnant or at the beginning of pregnancy. As a general rule of thumb, way back in the day when my Grammy was pregnant, I think they told me to gain 100 pounds. Eating for two meant eating for two. Babies this big, I'm sure. But now we're a little more realistic, and we know that eating for two means babies this big, so we have to be really careful about that. So kind of back to the BMI issue, if you are of a normal weight, we want you to gain roughly 25, upwards of 35 pounds. If you kind of fall into the overweight or a little bit of the fluffy area, we're going to want you to gain more, 20 to 25 pounds. If you've hit that unfortunate mark of a BMI of 30 or greater, where we're hitting those obese categories, we're really going to want you to keep your weight gain around 11 to 20 pounds. Okay? Newer recommendations in pregnancy regarding exercise are going to help you with this weight gain factor. We used to say, if you are newly pregnant, you don't get to exercise, we don't want you doing anything strenuous, we want you to lay on the couch and eat your bonbons. No, not anymore. We want you to move your bodies, get aggressive, and be aggressive. And this goes with being pregnant as well as not pregnant. And these new guidelines came out just very recently in May of 2011. So for people that are already active, moving their bodies, exercising 3 days, 4 days, 5 days a week, we want you to continue that and move it up to at least a 5 to 6 day a week exercise program if you can. What we want to see people do is move their bodies for a minimum of 30 minutes doing some form of cardio activity, be it riding a stationary bike so you're inside, don't get hit by a car, get on an elliptical so you're not hurting and pounding on your joints, get on a treadmill and walk aggressively. Swimming, excellent during pregnancy. Most people by the end of their pregnancy are feeling so heavy, and when you get in the water you feel nice, light, and buoyant, so swimming is absolutely fantastic. And you can actually swim on your tummy, swimming prone, face down. People ask, positioning with swimming. Any of the swimming techniques are fine, even swimming on your back if that's something that you prefer to do. So those are some of the exercises of cardio activity that we would like you to do. Now in terms of intensity, we want you to do these things at a level of intensity that's at least moderate to almost a vigorous intensity. And we rate that on a scale of 0 to 20, and we want you to run your range anywhere from 8 to 12, depending on your day, your energy levels, your time frame, and what you've done earlier in the week. For people that are not active at the beginning of their pregnancy or prior to pregnancy, we're going to ask you to start moving your body. We're going to ask you to start getting out there, starting out at 15-minute increments for 3 days in a week. And then as we progress through the pregnancy, hopefully by the middle of the second trimester, third trimester, you're going to be up to that good 5-day-a-week activity level. People ask me oftentimes about heart rate. How high can my heart rate go? Do I need to get a heart rate monitor? And, for people that already have heart rate monitors, that's great. I'm going to tell you, hey, try to keep your heart rate under 160 if you can. And you're going to find that is exceedingly difficult to do. And you're going to maybe find that you have to really back the intensity down more to a moderate level and extend your time frame. Good rule of thumb, again, intensity level 8 to 12 if you don't have a heart rate monitor, under 160 if you do. For people that already are doing more intense activity, They're going to ask, can I push that 45-minute envelope? Can I do an hour? Can I do an hour and a half? People that are running 10Ks, half marathons. And I'm going to tell those folks, yeah, you can. Once we start pushing the envelope repetitively of doing more than 45 minutes, an hour, hour and a half, really make sure that you let your obstetrician know. I want to know, girls in my group want to know. We want to make sure that you are compensating and getting enough calories in your day, making sure that baby is still growing appropriately and that those caloric needs are being met. And you're going to find as the pregnancy progresses, those really hard workout days may not be as intense just because of the body changes, the oxygen consumption changes, so those intensity levels may not be quite as high as they were, and that's okay if you have to kind of back it down. Remember, baseline conversation level is good for everybody, okay? For you women out there that are truly competitive athletes that are competing in triathlons, duathlons, any type of bodybuilding competitions, we're going to be a little more, I hate to say restrictive, but there's a little more information and detailing and individualization of your exercise program during pregnancy. So I'm going to save that conversation for you and your obstetrician. So if that's the case, please just sit down with us personally and we'll go through your programs on a little more individual detail. Back to kind of the weight gain, because we're just going to kind of wrap all this together. People often ask, how many calories can I eat in a day? And I tell most folks, if you're in your first and second trimester, you need about an additional 300 calories a day, which is going to be a piece of wheat toast and an apple. Not the caramel covered kind with the nuts, because that's going to be way too much. I know they're good, but you're going to have to back that off. Just a piece of toast and an apple. So keep that in mind. And then as we hit the third trimester, those calorie consumptions really can go up 400 to 450 calories a day additional. Now, if you're on a 3,000 calorie a day diet, it's not going to be good. You need to be backing all that stuff down. So I'm basing this on most ADA, American Diabetic Association calorie diets should be about 1,800 to 2,000 calories a day. So that's where I'm basing this 300 and 400, 450 on. So if you're much beyond that, you need to slowly start bringing those calories down so that we're at a reasonable value, which goes back to the whole BMI from where we started. Nutritional supplementation, prenatal vitamins are always another big question. Do I need to eat, iron? Do I need to eat more calcium? Do I need to eat more leafy greens? I'm going to tell you yes, 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 yes. Okay, it all boils down to the new food pyramid, which really has turned into a food plate. Everybody needs to be getting good 2 to 3 fresh fruit servings a day, 2 to 3 fresh vegetable servings a day, 2 whole grain servings. And examples of whole grain are going to be brown rice, quinoa, couscous. You want to do brown breads, whole wheat bread, rye breads. For example, you want to stay away from the white breads, the white pastas, the white rices, okay? The white potatoes. You want to stick to sweet potatoes. And then in terms of protein, we want you to do a good 3 to 6 ounce servings of lean proteins like chicken, pork, lean beef, and then fish. Now fish is going to take us into a whole nother category because people are always asking, fish and mercury, oh my God, am I going to glow in the dark and so is my baby? So our recommendations for fish consumption are going to be keep it to the low mercury fish. So fish to avoid, shark, soy fish, king mackerel, just don't eat them. Okay, and then there's a couple of outliers that they don't even sell around here in the Norman area, so I'm not overly worried about. Okay, tuna then becomes a question. How many cans of tuna can I eat a week? You can have at least 1 to 2 meals, 6 ounce serving of tuna, but you want to keep it to the light canned tuna that has less mercury than the albacore. The albacore tunas have a little bit higher mercury content because those fish are harvested larger, so they're out there and exposed more, so you want to keep it to the light canned tuna. And then obviously this rolls into sushi. Everybody is on a sushi kick, which is great. You can eat sushi, that's fine. Keep it to 1 serving a week if you're going to be doing, like I said, the mackerels, I'd like you to avoid. But the tunas, really try to keep it down to 1 serving a week, even with the tunas. But the salmon, the calamari, the eel, those are all fine. pregnant or not pregnant, make sure you go to a reputable sushi restaurant and make sure that the meat smells fresh. Any type of distaste, obviously don't eat sushi. Just good rule of thumb, pregnant or not pregnant. On to prenatal vitamins and such, kind of back to this whole nutritional thing. For people that are eating good, clean diets, that are following the food pyramids, what I want to see in your extra, what do we have to have, is about 1,000 milligrams of calcium a day, because baby's going to be snagging your calcium to make their bones, their teeth, their cartilage. So people over the age of 18 need to be getting about 1,000 milligrams extra of calcium a day. 14 to 18-year-olds need to be getting about 1,300 because your bones are still developing on their own so much that a baby taking your calcium is going to deplete you over time. So that's pretty much it with calcium. Great way to get calcium, Tums, Rolaids, easy way to just chunk them down every day. You get that extra calcium that you need. It absorbs very well and also helps with that heartburn that you have. Iron, we want you to get at least 30 milligrams a day. We'll check that again as we get closer to the middle portion of pregnancy when we check your glucose tolerance testing. And if your iron stores seem a little bit low, often at that time we'll say, hey, go pick up go pick up an iron supplement over the counter where you're getting at least maybe 65 upwards to 120. Kind of depending how anemic you are, your obstetrician will talk to you about that and nail that dosing down a little bit closer. And sometimes you have to continue that through the postpartum period. Nutrition during the postpartum period with breastfeeding is pretty similar during pregnancy. Breastfeeding is going to burn about 650 calories a day. It's a great way to get that baby weight off, is to breastfeed. So you want to make sure that you're still getting enough calories in your day so that you're in that point where you're losing a little to get back to that healthy, trim life, but also that you're getting enough calories to maintain that milk supply and that supplementation. So again, during that time, calcium, very important. Continue with 1,000 milligrams, and then if you were prescribed iron when you were sent home from the hospital, you're going to want to go ahead and continue that. So at this point, this is pretty much the new, latest and greatest information that we have for you on nutrition and diet and exercise. So anything you guys have question-wise, any questions that you need answered, what exercises are good to do, we'll be more than happy to get into the nitty-gritty with you during your office visit. So thanks for watching, and we'll see you guys next time around.